everybody, it's Cookielu in Monterrey, Mexico. I had my surgery yesterday and I'm feeling good. A little sore on the arms, which are nice and skinny compared to the one I came in here. And my breasts, of course, are a little sore. A little bit of a story on the breast. Because I had those implants in for 33 years, I was suspecting that it was time to take them out because it wasn't healthy to keep implants in a breast that long. And unfortunately, Dr. Saucedo, when he was removing the breast, the implant on the right side, it had ruptured, and it looked pretty darn ugly when he put it out, and he had to do a lot of cleaning up and removing it, and as a result of that, he did not give me new implants. He wants to wait 6 months to have me recuperate and to heal up before he puts any more implants, foreign objects in my chest. So I'm a little disappointed, of course, because now I'm back to my little tiny boobs. But he did lift them, so I'd say 50% of the operation was done. And I was very upset to find out that the reason why that particular one had gone bad was because the implants that my doctor had used 33 years ago were double baggy implants, where it was silicone on the inside and like a casing and then a layer of saline and then another casing, so it was double bagged for the purpose that if anything should crinkle or crease along the years, then the only thing that would leak out would be saline. This, we found out when he removed it, it was a larger implant because it was a smaller breast that needed to be filled out and balanced, was not a double bag. He had no saline in it. It was manufactured by Dow Chemical, which most of them were and probably still are today, but it was the one implant that they had a class action suit against that were rupturing in people, and people were claiming they were getting sick, joint pain, or whatever. And he says it's one of the old-fashioned implants. And if it was a double baggy like the one on this side, it wouldn't have that rupture would not have happened. So when he came into the recovery room and he had a white linen napkin with the implants in them, and he went to show me, and one was just as good as it looked, but he put it in there 33 years ago. Dr. Baines was my doctor then. The other one was this big, flat, brown, looked like a sack of fudge in it. And he says, why is it so discolored? He says, that's because it was ruptured. And he's assuming, just a guess, that it probably had gone bad about maybe 10 years ago. So I had that poison crap laying in my body for 10 years. And that's why they say that every 15 to 20 years you have to change them out. However, nowadays, the implants that they're making are much more modern, they're more solid, they're more safe and secure, and they don't break easy at all.
Cookie, let's talk about this because it's so fascinating. Dr. Saucedo doesn't believe that the silicone was actually oozing or leaking into your body cavity. Why is that?
Well, every time you have any kind of operation, you get scar tissue, especially around implants. They get encased in scar tissue. They call that encapsulation. And of course, after all those years, there was a nice layer of capsulation around the implant. So he didn't even know anything was wrong until he started to cut on that capsulation to remove the implant. As soon as he sliced into it, all this stuff oozed out. So he says whatever was leaking from the implant came into the scar tissue, capsulation. So the first thing they did was they got a lot of biodine and gauze, and they just kept mopping and irrigating and flushing and mopping about a half hour before they even touched it to try to get it out of me. And they just kind of cleaned it all up until no more stuff was being evident on the gauze, and then they started to continue to remove the implant. He said that he doesn't think that anything
Sorry, guys, we had to take a little break there, and we've lost our train of thought. But we just had some medication given. Cookie's just received some morphine for a little bit of breast pain that she's experiencing. So talk about the pain, Cookie. How are you doing?
Primarily, I'm doing very well. There is no real discomfort. Dr. Salceda came in here this morning, and he just reiterated what he did in the operating room, especially with the breast and everything, how we cleaned it up. And he wants me to take this time to eat, to walk a little bit, and to rest a lot, and to not use my arms. Well, how could I not use my arms? But I had a shower this morning. Patty came in and gave me a shower,
and Patty worked here last night and worked with you, and Patty speaks English. So yes. I'm like, why isn't Cookie calling me? Why is Cookie leaving me alone and letting me sleep? Which I'm sure she's got stuff to talk about. But no, it was because you had an English-speaking, excellent, awesome nurse last night.
Patty is Dr. Sauceda's private nurse, and she's going to be taking care of us once we get to the hotel.
Right.
She'll be coming in and monitoring us every day. But she really, really is a wonderful nurse, and she's very sweet. And matter of fact, I called Joni up, and I told Joni, I met Patty, and make sure you give her a hug for me.
I'm going to tell everyone what the nurse is doing. You are on heparin, correct? Or are you on heparin still?
She gave me one shot, say that'll be the end of it.
So you were on a blood thinner because of your AFib,
yes.
And then you'll be starting your warfarin, which is also a blood thinner. But because you're at a higher risk for complications because of your AFib, they are going to be keeping your IV in throughout your hospital stay, whether they could give you oral medication or some other thing. Right. It's for just precaution. So our nurse, who's precious and sweet.
It's Elvira.
Elvira.
Elvira or Elvira?
Elvira.
Elvira.
No, yo soy Abril.
Abril. She's April.
April. Okay.
So anyway, she is changing out your dressing on your IV, and it is a little bit leaky, probably because of your heparin situation.
Well,
but
I thought it was because the drains were leaking quite a bit. I mean, they had to change the sheets twice and my gowns twice.
Wow.
Blood everywhere.
But your drains don't look bad, though, to be honest. When were they drained last?
I think this morning Patty did it.
We are on that weird 10-minute thing, and we are at 7 minutes, 45 seconds. Why don't we decide if there's anything else we want to share? So you had a shower. The food's been decent, right?
Decent. They don't provide knives here.
So bring your own plastic knives.
My fingers work just fine. There's spoons and forks. And the room is comfortable. The nurses are sweet. And all in all, it's been a very good experience. A lot of things different happened. Like when I walked into the surgery room, operating room. The first thing they did was make me stand on a pad on the floor, and they just washed me down with this Biodin, that orange stuff, scrubbed me good from head to toe. And I thought it would be cold, but it was nice and hot. It was
oh, wow.
Relaxing.
That's nice.
She sponged me. She must have went over me twice.
That's nice.
Walked me over to the operating table. She says, okay, get on it. And Dr. Sauceda's wife was there. She gave me a little pill to help me relax. They put a mask on my face, and the next thing I know,
you're waking up in recovery.
I wake up. And another thing that was new to me, too, and unexpected, was that Dr. Sauceda, when I got here and I was filling out the paperwork, I did not get the spinal block that most people get.
You mentioned that yesterday, and we are almost out of time here.
I got.
Sorry.
Okay. All right, that's it for now. We'll pick up again another time.
Okay, sounds great.
Bye.
Bye, guys. Hasta mañana. When I have my surgery, I'll be talking to you tonight, I think, on a Kristen Before Midnight.
Yes, Kristen's getting marked up tonight.
Yay. Talk to you later. Bye.
Bye-bye.